Hi, my name is Elizabeth Ferris Rowe. I'm an OBGYN at the IU School of Medicine and Eskenazi Health. I've been in practice for almost 20 years, always here in Indiana, and I'm excited to have this opportunity to talk to you about COVID vaccination in pregnancy. Having had 3 children of my own, I know it is hard when you're pregnant to decide what's the safe thing to do for you and your baby. And that's become even more true with COVID, just like me and you and everybody. We're all drinking from the hot fire hose in terms of new information that comes in every day. And it can be really hard to figure out what to do with all that new information and to know what the right decision is. So I just want to offer my perspective as someone who has dedicated my life to taking care of pregnant people and their babies, as well as someone who has children who I want to keep safe. And I think the first question, anytime you talk about a medication or an intervention in pregnancy, is it safe? And when it comes to the COVID vaccine, the evidence says yes. At this point, almost 200,000 pregnant women have received the mRNA vaccines. And all of the information to date is very reassuring. We've seen no increased risk of miscarriage, no increased risk of birth defects, no increased risk of preterm birth, no increased risk of anything as relates to the baby or the outcome of the pregnancy. We also have seen no increased risk in sort of vaccine side effects for pregnant patients. So being pregnant does not put you at increased risk of having any of those kind of side effects that people think about with the vaccine. And just as an aside, when we think about those side effects, I know they can be a little bit scary and can be a reason why you might decide to avoid the vaccine. But having been there myself, the side effects are unpleasant for like 12 to 24 hours for a small percentage of people who've received the vaccine. But those go away. They don't cause long-term side effects, and they really are a sign that your immune system is doing its job and that you're ready to protect yourself in case you're ever exposed to COVID. So then the next question is, if it's safe, is it recommended? And the answer wholeheartedly is yes. All of our professional societies, including the American Academy of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, and the American Society for Reproductive Medicine, encourage vaccination of people who are pregnant or attempting to get pregnant. And the reason is this. Pregnant people are at increased risk for severe illness if they get COVID. They're at increased risk of an ICU admission, requiring a tube to breathe, increased risk of something called ECMO, which is a machine that actually oxygenates your blood outside your body because your lungs are no longer able to do that job. And they're at increased risk of death. Perhaps you've seen national reports. We've had local reports of pregnant patients who have died during pregnancy after acquiring COVID. And you know, the thing about sick pregnant patients is that sick pregnant patients are terrible incubators for babies. And so we see in these patients that become severely ill, complications for their babies as well, in terms of decreased oxygenation, increased risk of preterm delivery, and sometimes very, very preterm delivery. So babies are experiencing complications associated with preterm birth that they could have entirely avoided had their parents been vaccinated. The other piece of it is that even for those patients who don't become severely ill, acquiring COVID in pregnancy appears to increase the risk of hypertension problems with pregnancy. And that's things like preeclampsia or eclampsia. And those conditions put both the pregnant patient and babies at risk, and they're also one of the most common reasons for preterm birth. So even in patients who don't get seriously ill, acquiring COVID anytime in pregnancy increases the risk of preeclampsia complications later on in pregnancy. So vaccination protects both the pregnant person and the baby from those complications during pregnancy as well as after pregnancy. The last thing that vaccination does is it allows you to protect the baby even after birth. So the vaccine itself does not cross the placenta. But the antibodies that your body makes in response to the vaccine do cross the placenta. And those antibodies are in the baby for like 3 months. And so in that really delicate period immediately after birth where we're trying to keep baby safe from everything, by getting vaccinated in pregnancy, you're able to provide that protection in a way that truly only you can. Additionally, vaccinating other parents, grandparents, childcare providers helps to do what we call cocoon the baby. So protect baby from exposure to that virus from those people who are near baby. So yeah, it's a hard decision. We worry that we're going to make the wrong one. But truly the choice is yours. And right now you are the person who has the ability to give this baby the best possible start in life. And by vaccinating yourself in pregnancy, you protect yourself from severe illness, you protect the baby from illness and the risks of preterm birth, and you can protect your baby for months afterwards, even longer if you breastfeed. So truly, when you're faced with this decision, I know it's scary, but don't be scared. Be reassured that you have this opportunity to provide protection to your baby and to yourself by getting the COVID vaccine in pregnancy.